How vaginal discharge changes during pregnancy. Vaginal discharge changes during pregnancy. Just as vaginal discharge changes throughout the menstrual cycle, it also changes during pregnancy. It is usually thin, milky white, or colorless, and with a mild odor, or no odor. Increasing vaginal discharge is one of the earliest signs of pregnancy. This discharge is referred to as leukorrhea. The term frequently refers to vaginal discharge during pregnancy, but leukorrhea is also present in non-pregnant people. In your first trimester of pregnancy, vaginal discharge increases in an effort to remove dead cells and bacteria from the uterus and vagina to help prevent infections. The amount of vaginal discharge you experience will increase gradually as your pregnancy progresses. As long as it remains generally colorless and odorless, it is normal and not cause for concern. Over time, this discharge also helps form the mucus plug. This plug blocks the opening of your cervix to prevent an infection from entering the uterus and harming the baby. Brown or pink vaginal discharge during pregnancy. Brown or pinkish vaginal discharge may also occur during pregnancy. This could appear as light streaks or spots of color on your underwear or the toilet paper when you wipe. If it seems like very light bleeding, it could be spotting. Usually, this brown or pink tinged discharge does not indicate a problem. Common causes may include implantation. Some pregnant people, but not all, see a small amount of brown or pink discharge or spotting at the very beginning of pregnancy, around the time their period is due. This may be a sign of implantation, when an embryo implants in the uterine lining, about 10 days after fertilization. It's unlikely that implantation actually causes the spotting or bleeding. The name is based on the timing. Intercourse or a vaginal exam. At any time in pregnancy, you may experience brown or pink tinged discharge following intercourse or an internal exam. This happens because the cervix and vagina are easily irritated during pregnancy, thanks to increased blood flow in the area. Vigorous exercise. A hard workout can cause spotting or tinged discharge at any point in pregnancy. As long as it does not progress to bleeding, it is usually just a sign that you should ease up on exercise. Bloody show. At the end of pregnancy, as your cervix begins to dilate, the mucus plug slowly breaks down and may come out in small bits, large clumps, or mucousy streaks. This may make vaginal discharge appear brownish or pinkish. Not everyone experiences or notices a bloody show. While it means that birth is approaching, it could happen hours, days, or even weeks before true labor begins. When to call your doctor. Some changes in vaginal discharge during pregnancy can be signs of infection that need to be treated promptly. Check in with your healthcare provider if you notice redness, itching, or swelling in the vulva, or changes in discharge including 1. Color. Yellow, green, or gray rather than colorless or white. Bright red, indicating bleeding. 2. Odor. Strong or foul smell rather than mild or odorless. 3. Consistency. Frothy or chunky cottage cheese-like instead of stringy. If the discharge is very watery and seems excessive, it could be amniotic fluid, or even urine. Since leaking amniotic fluid could be a sign of preterm labor, it's important to call your doctor and have this checked out.